Welcome. Today we're diving into a condition that can significantly impact a woman's health: ureteral endometriosis. We'll explore what it is, why it happens, how it affects the body, and what can be done about it. Let's get started. So, what causes ureteral endometriosis? It's essentially endometriosis that has spread to the ureter, the tube that carries urine from the kidney to the bladder. While the exact mechanism isn't fully understood, the most widely accepted theory is retrograde menstruation. This is where menstrual tissue flows backward through the fallopian tubes and into the pelvic cavity. These endometrial cells can then implant and grow on various organs, including in some cases the ureters. Another theory involves the lymphatic or vascular spread of endometrial cells. Genetic predisposition and alterations in the immune system are also thought to play a role, potentially making some women more susceptible to developing endometriosis in general, and therefore potentially ureteral endometriosis. Now, let's delve into the pathophysiology, or how this condition affects the body. When endometrial tissue implants on or near the ureter, it behaves just like the tissue in the uterus. It thickens, breaks down, and bleeds with each menstrual cycle. This can cause inflammation, scarring, and ultimately constriction of the ureter. This narrowing, known as ureteral stenosis, obstructs the flow of urine. Prolonged obstruction can lead to hydronephrosis, which is the swelling of the kidney due to the backup of urine. In severe cases, it can impair kidney function and even lead to kidney damage. Unfortunately, precise epidemiological data on ureteral endometriosis specifically is limited. It's a relatively rare manifestation of endometriosis. It's estimated that ureteral involvement occurs in approximately 1–2% of women with endometriosis. However, it's important to note that endometriosis itself is a common condition, affecting roughly 10% of reproductive age women. Because ureteral endometriosis can be asymptomatic in early stages, it's likely underdiagnosed. The signs and symptoms of ureteral endometriosis can vary greatly. Some women experience no symptoms at all, especially in the early stages. As the condition progresses, symptoms may include flank pain, which is pain in the side of the body, often radiating to the back or groin. Hematuria, or blood in the urine, is another possible symptom. Urinary frequency or urgency, dysuria, painful urination, and recurrent urinary tract infections can also occur. In more advanced cases, if hydronephrosis develops, it can lead to more severe symptoms such as high blood pressure and even kidney failure. Diagnosing ureteral endometriosis can be challenging because the symptoms can mimic other conditions. The diagnostic process often begins with a thorough medical history and physical examination. Imaging studies are crucial. An intravenous pyelogram, or IVP, is an X-ray that uses contrast dye to visualize the urinary tract and identify any blockages or abnormalities. A CT scan or MRI can provide more detailed images of the ureters and surrounding tissues. A retrograde pyelogram, where dye is injected directly into the ureter, can also be used. Cystoscopy, a procedure where a small camera is inserted into the bladder, can help visualize the lower urinary tract. Laparoscopy, a minimally invasive surgical procedure, is often the definitive diagnostic tool, allowing for direct visualization and biopsy of the affected tissue. The biopsy confirms the presence of endometrial tissue, solidifying the diagnosis. While there aren't distinct classifications or types of ureteral endometriosis in the same way you might classify cancers, it can be categorized based on the location and severity of the ureteral involvement. It can be intrinsic, meaning the endometriosis is within the wall of the ureter, or extrinsic, meaning it's pressing on the ureter from the outside. The degree of ureteral obstruction and the presence or absence of hydronephrosis are also used to classify the severity of the condition. Treatment and management of ureteral endometriosis depend on the severity of the condition, the woman's symptoms, and her desire for future fertility. Medical management, primarily with hormonal therapies like oral contraceptives, GnRH agonists, or aromatase inhibitors, can help suppress endometrial tissue growth and alleviate symptoms. However, these treatments don't address the underlying obstruction and are often used as a temporary measure. Surgical intervention is often necessary to remove the endometrial implants and relieve the ureteral obstruction. This can be done laparoscopically or through open surgery. Surgical options include ureterolysis, where the endometriosis is removed from around the ureter, ureteral resection, and anastomosis, where the affected portion of the ureter is removed and the healthy ends are reconnected, and in severe cases, ureteral reimplantation into the bladder. Post-operative hormonal therapy is often recommended to prevent recurrence. Unfortunately, there's no guaranteed way to prevent ureteral endometriosis. However, lifestyle modifications that may reduce the overall risk of endometriosis, such as regular exercise, a healthy diet, and avoiding exposure to certain environmental toxins might be beneficial. Early diagnosis and treatment of endometriosis in general may also help prevent its progression to more severe forms, including ureteral involvement. The prognosis for women with ureteral endometriosis varies depending on the extent of the disease, the success of treatment, and the individual's overall health. With appropriate surgical intervention and medical management, many women can experience significant symptom relief and preservation of kidney function. However, recurrence is possible, so long-term follow-up is essential. Recent research is focusing on developing more targeted therapies for endometriosis, including those that specifically inhibit the growth and spread of endometrial cells. Additionally, advances in minimally invasive surgical techniques are improving outcomes and reducing recovery times for women undergoing surgery for ureteral endometriosis.